Good evening, everyone. Thank you for coming this evening. I am Julia Noah, and I would like to do a little introduction about who I am in my day-to-day life. I am 24 years old. I started having migraines when I was 23, so about 6 months ago. It happened at work, and it just it kind of freaked me out. I lost my hearing. Half of my face went numb. I had a really bad headache on, I remember, my right side. And then I went to where I couldn't actually see my email, where I couldn't see my phone, and I couldn't make out a full sentence. And that was the most embarrassing thing at work, because when you can't finish a full sentence, it's kind of humiliating. But I never had any big headaches when I was little or younger. I want to do this because I want people to understand the pain that others go through, and how unique migraines can be to each person. But let me ask, before we get all this started, in the audience, I know there's a few of you, let me ask, how many have actually experienced a migraine or thought you experienced a migraine? 1, 2, 3. All right, so not too many. Okay, so that being said, with the show of hands again, how many people actually know a loved one or have loved ones that have migraines or have really severe headaches and you have to take care of them? Yeah. Just about everybody in the audience. All right, well, that's not a surprise to me. But that being said, I think a lot of you, if not every one of you in the audience, will actually really get something out of this presentation that we're about to go through. So, without further ado, the killer headache, migraines. So what we're going to start off with first, I'm actually going to take you through what a migraine looks like inside your brain. So number one, and I gave you the handout when you first walked in the door, so if you want to follow along with that, it's a little bit easier to see, a little bit clearer. So the first thing that you're going to be experiencing is your misaligned vertebrae. So your misaligned vertebrae will be right up here in your neck, your upper neck closer to your head, and if it's misaligned, what I learned from my chiropractor, it can definitely cause a migraine instantly, because your blood cells start to pressure, and that in turn actually irritates your spinal nerve. So then moving on up, so here's your misaligned vertebrae, and then moving on up right here is going to be your pressurized blood cells. They actually, once they get so pressurized, they reduce the flow of blood to your brain. So you're not stupid. It might just be that your vertebrae are misaligned. So in turn, once the blood flow starts to reduce, those irritated nerves may swell your vessels, and like further up, they cause them to narrow, so further reducing the blood flow. And then leading up here into your brain. Oh, before that, if you have not been to a neurologist, I strongly suggest in going and talking to one. I'll talk to you later on about the neurologist, but I got an MRI done, an MRA, and I know it was very weird. I've never had one done before, so it was definitely a first. But it's helpful, very helpful. The neurologist told me in this area right here, between your vertebrae and all these blood vessels, there's one blood vessel in particular, and I wish I had my x-ray. or my MRI, because there's one in particular that if it's starting to get tangled up or it's starting to dilate and get a little bit bigger, that in turn can actually cause a stroke. So, I did not know that. So, many people with migraines are known to have strokes too. Didn't know that. But anyways, moving on, sorry, a little off track. Up here in your brain, your blood vessels in your head start to expand, and that offsets the reduced blood supply. And that sudden expansion actually irritates those surrounding nerves, all these surrounding nerves in your head, and that is what actually causes the throbbing pain. So yeah, I didn't know that. That's always good to know. So moving on, what are some of the symptoms? I know everybody has different symptoms. Studies have shown that one of the most common symptoms is that throbbing, that pulsating pain. It might not be on the one side of your head. It might be all over. It might be in your sinuses. And we'll talk about the different types of headaches as well. And then also light sensitivity. Light sensitivity is usually a different type of light. Say if you're at work and you have overhead lighting and you're starting to notice that you have migraines a lot, I would definitely purchase really, really bright floor lamps. That's what I have in my office actually, and it helps so much more than those overhead lighting. Definitely get one of those those glare screen protectors. That helps really well too. So sound sensitivity. I haven't had this one yet, but it's kind of like what's been described to me is if you have a really bad hangover and somebody, comes walking up to you and you feel like they're yelling at you and it just starts all of that pain and all that throbbing. That can also be a really intense symptom. Nausea. Nausea is something I have because I have a very weak stomach. I know a few of you in this room that have migraines, and y'all have very weak stomachs as well. I've actually gotten to find that one out on my own. So nausea and vomiting usually come in hand. I don't have the vomiting. I just have kind of the sick to my stomach feeling, which is very common. And then the pain on one side, a lot of people have that. If you're having it on both sides, or if you're having it all through your forehead, that's going to be a different type of headache. However, even if it is really intense, it could still be a migraine. It just depends. And vision changes, for instance, blurred vision, like when you're driving and you start to get that really weird tunnel vision and it gets smaller and smaller and smaller tunnel, that can be an issue. One thing that I know from experience is auras. They're very hard to get over. Think about, if you will, if you looked up into the sun. So, I know when we were all kids, we used to think it was so cool to look up in the sun for some odd reason. So think about looking straight into the sun and then closing your eyes and opening them again. And you see like spots or dots or even starbursts at some point. Mine are really bad starbursts. So they kind of just, I don't know how to describe it, but they kind of just do one of these, and they close in on one specific area. And that's what makes it very hard to read, because I can't see past one word or the other. So those are some of the symptoms. There's much more. These are just some of the main symptoms of a migraine. I know a lot of people actually, um, their triggers actually are more intense than their symptoms. So, and we will be explaining triggers next. So, how many in this room, by a show of hands, can or know what their triggers are? Okay, hardly anybody. That's how I was before I went to the doctor, before I went to a chiropractor. So we'll go over some of the triggers now, and triggers and causes. So a few of which are easier to kind of maybe adapt to your life, or a few are a lot easier to change in your life than these first few. The first few I'm going to talk about genetics, health, hormones, and injury. I know that sounds kind of weird, but definitely some of the major triggers. They're doing studies now, and they've done a lot of studies in the past that genetics is actually one of the main triggers or causes. It can be caused, and it can be coming from a gene. I know that on my dad's side, the parental side, we all have migraines. My granddad had very severe migraines. He took a lot of medication for it. And in the end, he actually passed away from multiple strokes. My dad has horrible migraines because his are very uncontrollable. He can be sitting in a room and he's kind of like me, it just all of a sudden hits him. So genetics has, you can't really help it. It's just kind of in your genes. And I'm kind of hoping one day they'll finally find a way to reduce the pain and for our children and our future. So the next thing is health. What kind of health are you in? Are you getting enough vitamins? Are you healthy all the way around? Breast cancer, cancer in general. It just depends on what your life is like and your stress level. Stress has so much to do with migraines. I can't stress that enough. But moving on, hormones. Hormones are mainly what mine are. My progesterone levels and estrogen levels are so out of whack, and they're hard to maintain for natural balance. So yes, many women do experience migraines right around their that time of the month, or they stop having them after they have their hysterectomy. So hormone levels definitely is a big issue. Injury. I don't think anybody in this room would have ever guessed injury. This one I actually learned from my chiropractor, Dr. Breen, here in Midland. I was in a very bad car wreck when I was little. I was still a baby and I was in a car seat, and never went to the chiropractor. I've been a few times in high school, but I never really. I've always had a really bad back, really bad lower back, but I never thought, this would be maybe something to look into. Sure enough, went to the chiropractor and he worked on my neck. And I know it's a scary thing, but working on your neck is probably the biggest help. It really does keep you aligned, and if you get completely aligned and you get a lot healthier and you start taking your vitamins, get everything in the right order, it can definitely help your migraines. So a few more triggers that we can talk about. These are the ones that you can actually control in your life. Although I know a few, some people don't want to think about. Alcohol.